Welcome back, everybody, to our House Call series, From Confusion to Clarity. We're continuing our conversation on ethics. So, Barry, in our last conversation, we talked about rights and obligations, how they're supposed to be reciprocal. We also talked about how the many codes of human conduct was actually developed, and it was developed from the past. You talked about the Ten Commandments, the Nuremberg Code, and the fact that, well, especially for the Nuremberg Code, that the rights of the individual actually came out of World War II.
Yeah, I think it's important to know that so much suffering in the world has come about because we elevate the rights of one individual or one group over the rights of another individual or a group. Yeah. And rights don't necessarily have to be identical to each other, nor must obligations, but there has to be a certain sense of reciprocity between the rights and obligations of one group and another group. So for example, if I have an infectious disease that's communicable, I could pose a risk to someone else in society. So it's perfectly reasonable that there might be limitations put on my behaviors. And as that disease becomes more serious, the limitations might become more serious as well. But at the same time, society has to recognize that in order to protect itself, it's not allowed to necessarily breach all of my privacy and confidentiality in the process of trying to protect itself. So society has to find sufficient justification for the limitations it puts on me that are as least intrusive as possible so that they interfere with my rights as little as necessary to protect the rights of society. So there has to be some kind of reasonable threshold. Otherwise, as we've seen in World War II, for example, it's very easy for the rights of the collective to completely trample the rights of the individual. So a good example I would give you would be, suppose that I had a seizure disorder that was not completely well controlled. So it would be quite reasonable for society to put limits on my driving or on perhaps the occupation I might want to follow. So if I was going to become an airline pilot, they might well say, no, because you have an not fully well controlled seizure disorder, perhaps we should not allow you to be a commercial airline pilot. But that doesn't mean that they have rights to control every single aspect of my life. Only the aspects which could put the public, society at large, at risk should I have a seizure at an inopportune time.
I think that then the real question is how much can society demand of one given individual to accept risk, harm, or loss of freedoms, what you're talking about, to purely protect that of society?
Yeah, I think we have to, in developing these rules, make sure they're fair and just. They can't just be whimsical or opinion-based. They should be backed up by an argument. Not an argument in the sense of fighting with each other, arguing, but a philosophical argument, which is basically you start with the premise, you come to a conclusion by using a justification to explain why that conclusion is valid. So, for example, a very good argument would be to say someone with an uncontrolled seizure disorder could be involved in an occupation which could put society at risk. Therefore, there may be situations in certain jobs they might occupy which would put society at too great a risk, flying an airplane. So the justification is because so many people flying a plane could crash, someone with a seizure disorder is not well controlled, should not fly a plane. However, to say that someone should become an accountant because of a not perfectly well-controlled seizure disorder is a very weak argument. There's no risk put to the public if I became an accountant if I have a seizure disorder that's not well-controlled. Not nearly as powerful an argument as if I were going to become a pilot. An analogy would be in COVID. They were saying early on, say May, June of this year, that the vaccines were safe in pregnancy. And I thought to myself, is that really a valid argument to say that they're safe in pregnancy? Because the original studies that were done in 2020 purposely excluded pregnant women, which means that we only knew about pregnant women getting vaccinated in January of this year. And common sense would tell you that with a 9-month gestation, the women who had received the vaccine during pregnancy, many of them had not yet delivered. There was no possible way in May or June of 2021 we could possibly say with any evidence that the vaccines were safe in pregnancy. That was more a wish or a hope. It was not a very good argument because it wasn't backed up by any reason or by any data or information to support that.
That's interesting about the pregnant ladies. I didn't realize that. I've never understood, so if we're talking about COVID and being contagious, I've never understood how how they can justify limiting our movements or saying that we're contagious or saying that we're dangerous if we've never been sick or we've never been around anybody that's had COVID. What are the justifications then?
Well, I agree. I mean, normally what we do is we quarantine sick people or symptomatic people, not healthy people.
Yes.
And if we are going to quarantine people, it's because the organism they have is very communicable. It's potentially very serious, and if we do quarantine them, it's always for a limited period. It isn't indefinite. And one of the questions of many that I've had during the pandemic is, are we really sure exactly how this virus is transmitted? Because I've heard talk about airborne, respiratory droplet, and fomite spread. Well, which one of all of these is the most important? Do we have really good evidence, and I don't think we do, that there's really much to worry about in terms of asymptomatic transmission? So, for example, someone with no symptoms but simply a positive PCR test. And if they are able to transmit the virus, are they as likely to make someone really sick as someone who's very symptomatic? So again, as we spoke about, I think, in previous videos, if I have a positive PCR test but no symptoms, am I as likely to make you sick as a patient who's very, very sick in intensive care unit, intubated, how they might make the nurses working with them sick? The transmission's got to be different. There must be some transmission stratification process, but I've not heard what that is. So, in that respect, there's been a concern that transmission could overwhelm the healthcare system. But, we're 22 months into the pandemic. I haven't really seen much evidence that the system has been overwhelmed. And again, the system is often overwhelmed even in normal times. And by 22 months, we should know whether the system has been overwhelmed or if it's going to become overwhelmed.
There's a whole bunch of things that you said, and my mind is actually kind of swirling of which one I want to address first. I guess the first thing I want to say is we know that the emergency protocols were not followed. There's a retired Lieutenant Colonel Redmond who was actually talking about that. He's the head of the emergency management services in Alberta, and he would be the guy to call under any emergency. And we know that all provinces have their emergency plans, and their emergency plans are basically to protect the vulnerable. That's the standard protocol. Protect the vulnerable, let the rest go. That's what you would do. And we know that wasn't followed. We know that we have a recovery rate of 99.97%, something along there, without intervention. We know so we have that recovery rate. We know that the hospitals aren't overwhelmed. And so, there's so much confusion as to how they continue to justify, I guess, essentially these lockdown measures.
Well, yeah, I'm not sure we've used science as well as we could to supply the evidence needed to make a good ethical justification for a lot of the measures we've used, including lockdowns and social distancing, etc., in order to limit the spread of the disease. I mean, when we're going to institute measures, we should be trying to do more good than harm with the least impingement on individual freedom and free flow in our economy as much as possible. For example, I was always curious, who decided who is an essential worker and who is not? And I was always curious, how much sicker or how more often did essential workers get sick than people who were not essential workers? Did they get sick and die more often than those of us who weren't allowed to continue with our normal work lives? And as we said earlier, normally we only quarantine people who are sickly, not people who are not. And yet we made people who are well, who were deemed non-essential, have to stay at home. Did that really change how often they got sick compared to people who were still working, who were deemed essential?
And furthermore, and this is sort of something that's very big that we looked into from the beginning, there is no definition of what constitutes an essential business. So they do have essential workers, meaning like your primary first responders, if you will, like police, hospital, paramedics, those types of essential workers. But there is actually no definition of an essential business. And those guys were shut down, all in the name of protecting society. And so, we think about, I think actually about the elderly people and those long-term care homes. Many of them avoided COVID, right? So they were locked away. They avoided COVID, but yet they died from things like loneliness. They died from isolation. They weren't with their loved ones.
And in some ways, I think they died of other diseases that perhaps weren't as aggressively treated because of the measures that were implemented in terms of the social isolation of nursing homes, for example.
And overlooked, because they're all trying to focus on COVID, and it was overlooked. Is that, I would think is that what you're saying? I think that they were overlooked.
Oh, I think so. And, it's been said that societies can be best judged by how they treat their most vulnerable.
Yes.
And I would include the children in that group as well.
Yes.
And I think we have to accept the fact that no matter how careful we are in wanting to protect the vulnerable, we are never going to be completely successful. We can't stop germs from entering nursing homes. And there are people in nursing homes who are so vulnerable, it won't take much of an illness for them to become fatal for them. And so we do our best, but we cannot expect perfection. And one thing we should not do in trying to aim for that perfection is worsen vulnerabilities already. And you mentioned it in terms of not taking care of their other diseases, their loneliness, their being with family and friends. I'm sure many people in nursing homes have some element of dementia. When they're not in their usual routines and seeing their family, that's going to make that worse, and that's not going to improve their quality or quantity of life.
Exactly. Because ethics is such a huge subject for us, let's continue the conversation again, re-examining that question, is how much risk or harm is ethically justifiable for an individual to accept in order to protect society?
I agree. And, one last point before we get to that is that it's important that we don't create new vulnerabilities with our measures. Social isolation will affect us in terms of our mental health, and that can make things worse. Poverty breeds ill health. If we don't exercise, that does not help our cardiovascular system. If we're not able to exercise, we increase our weight, we worsen our diabetes, etc. I always felt very sorry during the pandemic for people battling substance abuse because they couldn't meet in person. What adverse effect did that have on them trying to deal with their addiction or abuse, for example? Ethics can help us to develop a way of assessing the benefits and harms, the moral pros and cons of the measures we institute. And we have to recognize that there will be measures that will be instituted that will do more harm to some people than others. Not everyone will be equally harmed by social isolation. Some will be very harmed, some not very harmed at all. And we have to acknowledge ahead of time that there will be harms from our measures to combat the COVID virus. And we need to not just acknowledge it, but we need to monitor it and at the same time try to minimize the harm, because we will do harm and the risk of the disease may not be as bad as the risk of the harms. There are lots of people out there who are harmed far more by the measures than they ever would have been by the virus itself.
Well said, Barry. Okay, well, thanks very much. We'll pick this up on the next conversation then.
Good. Thank you, Paul.
Thank you. Thanks, everyone.
Thank you.